Thanks very much. Good afternoon, everyone. In the next 10 minutes, I'm just going to briefly introduce you to LifeSpot Health, tell you a little bit about our systems that we've developed over the last couple of years, but I'm going to concentrate specifically on our medical cannabis vaporising system that we've got here on display at the show. So LifeSpot Health is a ASX, Australian Stock Exchange listed company. We listed in Australia in 2017. We have a company in Germany called LifeSpot Health, and we have two systems, three assets in our business. Firstly, BodyTel, I'll briefly describe today, and then Seng Vital cannabis vaporisers, I'll spend a little bit more time on. And then we have LifeSpot, which is our original name, which was a skin disease algorithm system. Our business, we own 100% of all of these businesses, and our core strategies are for BodyTel to partnership with device manufacturers who are diagnostic device manufacturers to leverage our ISO 13485 medical grade platform for doctor and clinician interface and connection with the patient. Our Seng Vital business's core strategy is to be an OEM. So if you swing by our stand later on this afternoon or tomorrow, you'll see that the systems we have on display here are designed for medical cannabis and recreational cannabis companies to develop systems for you to engage with patients and your recreational consumers. I won't spend any more time on LifeSpot today in the essence of time. Firstly, our BodyTel platform we developed in Germany. It's a software platform with an ISO 13485 accreditation as well as some other certifications. It's a doctor portal that brings in diagnostics from any Bluetooth device. So anything with Bluetooth, we connect with our BodyTel platform. And you'll see it with our team, I'll show you in the end in a couple of minutes, that we've got a very capable team. Anything with Bluetooth, that hardware, we can connect with that system. I'm going to move through that reasonably quickly so I can demonstrate the cannabis vaporizer to you. This is the BodyTel platform. Through the Bluetooth devices, we bring the data onto the BodyTel system. That BodyTel system has ID management, patient data management, for secure patient data management. We have business logic systems in there. We have notifications and alarms that you, as our client, or the doctor, as your client, can set to manage the patients. And we have an analysis and reporting system built in. We have interfaces, HL7 interface for hospital equipment. There's neural net for AI, machine learning, and we also have built into the system a bolus calculator for feedback and recalibration of bolus for the patient, and other customizable add-ons. I say to most of our clients, 80% of any of your telemedicine needs in managing the patient data is already built. There's really only 20% modification required for this back end to be modified for your systems. So that's how we pitch our business as an OEM using that BodyTel platform. And you can see on the right-hand side there, you won't be able to see it very clearly, but you can see there, in particular in Europe, with B. Braun and Boira, we have integrated in our systems now blood glucose sugar devices, INR or coag check for cardiovascular patients, scales, of course, and smartphone movement devices and what have you, the oxygen meter from Boira, and the ECG and blood pressure meters. So they're already in our BodyTel system, already with those companies, and we welcome other companies with those sorts of devices that are looking for collecting data from patients and holding it in a secure environment and allowing doctor access to come onto our BodyTel platform. So we continue to bring new devices, diagnostic devices onto BodyTel. As you can see, it's mostly focused on metabolic syndrome like diabetes and cardiovascular disease, with some focus with getting patients out of hospital and into home faster through having devices in the home that enable the doctor to manage those patients. But enough of that. Up the top three there, you'll see we bought a company called Seng Vital last year who have a very nice technology in vaporizers for cannabis. I'll go through those now. Get the button right. Here we go. So this is our medical cannabis vaporizer. I know you won't be able to see it too clearly here, but this is the medical cannabis vaporizer that vaporizes cannabis or flower, and it does that because it has a touch screen on it and you can adjust the temperature on the vaporizer So obviously you want to increase the temperature when you've got the mouthpiece in for flour or oil. That's the mouthpiece in the device, and we have these operating, or this operating and on display over at our stand if you want to come and have a look later on today or tomorrow. Now this device, I switch it on, it's fingerprint activated, so we know exactly who the patient is who comes onto the system, and it is Bluetooth enabled. So this one's configured for chronic pain management at the moment, so I've switched it on and I've identified myself with my fingerprint, and it's asking me how's my pain on the 1 to 10 pain scale. So I tell what my pain is, enter my pain, hit the home screen, and then I vape. I hold the button down and vape, and I'm not going to suck on it now. I don't want to go on video live showing I'm smoking on stage, but already that vape is now synced, well actually it's synced to my smartphone, and it's already sitting on our BodyToll system back at the stand there for the doctor to have a look at. That's essentially how this system works. It's US FDA ready. We know a US FDA recognises ISO 13485 now, but we also have a QR code system on the smartphone app so that we can register if you want, as our client, every pod or batches of pods that come in onto the system. And we can also register the doctor using a QR code. So your healthcare professional who's prescribing cannabis in the clinic can provide the patient with a prescription that's actually QR code enabled to switch on the device. Ceramic heating system, 2.5 mil of oil or less for different markets, dry flower capacity of 1.8, and there's some other specs there I don't need to go through. It's currently configured for pain tracking, but we developed the firmware ourselves and pushed the firmware down to our manufacturer, so we can reconfigure this for any other therapy that you want. If you want to track nausea along with pain, or if you want to track epileptic fits or whatever area of medical cannabis you're focusing on. We currently have two screen entry here, so one is the temperature adjustment and the second one is for the diagnostic of what the patient's feeling, but we can change that to have two diagnostics on the screen as well. Like I said, you know, we can push whatever firmware you want onto the hardware to suit your needs. And of course we supply the capsules for you to fill in your manufacturing facility, and we supply the hardware already boxed up, ready to go to the patient. In addition to that, we also have a recreational cannabis device. Once again, I'm sorry you can't see that clearly, but this system is in a rechargeable box. This is a fingerprint-activated, Bluetooth-enabled recreational vaporizer for oil. And once again, OEM for recreational cannabis companies. Fingerprint activation is a great child-proof innovation that we're bringing to the market. And of course with Bluetooth-enabled device, it means we can work with you, our clients, to develop whatever you want to put on your recreational cannabis app to engage more with your consumer. Some things are already built in there, like a leave behind warning on the smartphone, sleep mode on the device. So we're really talking about a higher engagement of vaporizer and something that you can engage more fully from a marketing perspective with your customers. This is what the BodyToll system looks like. Now, if this was live, you'd see my vape session up the top there now. Our anonymous patient, Claire Brown, is the patient on the vape at the moment. You can come and see that back at the stand if you want to come over and have a look at that. We're currently tracking vape sessions on this screen, but you can see that we can also checkbox. We can track all of the devices that are connected in to that patient. So this is the doctor portal, as I said before, ISO 13485 accredited. This is the screen that our patient Claire sees on the app. As I said before, currently configured for pain. But what's super interesting about this is that we can already see how much she's vaping, and we can actually let her know when we need to resend her capsules, or if it's a recreational patient, a customer, and our client or your brand want to remind to reorder, our system is already able to manage that. And keep in mind, with an ISO 13485 platform on BodyToll, we can manage patient privacy in all of the compliant ways that you need in your country, but we can also work within your privacy policies as a recreational user. Just lastly, I'd just like to talk a little bit about our team. So you'll see Gregor and I here today. Gregor has had 20 years of experience developing electronic hardware in Europe and America. Heiner, who's not here, is our key developer. The top two guys there, best-in-class hardware development electronically. Right-hand side, best-in-class software Bluetooth connectivity. So, and then there's myself with a pharma marketing background, and Greg Plunkett on our team is a regulatory and clinical expert. So we really feel well positioned to be able to work with you, our clients, on the clinical side and on the recreational side to meet your OEM needs in medical cannabis vaporising or recreational cannabis vaporising. Thanks very much. Come and see us.